Being active has never been more rewarding.
It's always a privilege to sit down for a one-on-one with our Minister of Health, who, despite his busy schedule, always makes time for some health education.
Minister, before we talk about the health of the nation, let's talk about your health. How are you doing?
I think I'm doing fine. I've just been for a checkup at Steve Biko Academic Hospital 2 weeks ago. My blood pressure, blood sugar, everything was checked. Physical, and I think I'm all right.
One of the points in your 10-point plan is improving the quality of healthcare to all South Africans. How are you doing that?
The country is going through a quadruple burden of disease. Many countries around the world do talk about a double burden, but in South Africa, it's definitely a quadruple burden, which consists first and foremost of the problem of HIV, AIDS, and TB, and secondly, the problem of maternal and child mortality, and thirdly, the issue of non-communicable diseases, as in diabetes, high blood pressure, chronic heart diseases, and lastly, and unfortunately, the issue of violence and injury. So all our plans are based on how to deal with this quadruple burden of diseases.
What role is health education playing in your plan to overhaul the healthcare system?
The biggest plan of health in the country, as you know, is to combat the scourge of HIV, AIDS, and TB. Fortunately, we do think we are making inroads. The 8-city campaign which we have launched, where we wanted to test 15 million South Africans, it exceeded our expectations. Many South Africans came to test to know their status. We have increased the number of people who are on ARVs from about 900,000 in February 2010 to presently 1.7 million. The number of health centers where people could go and start ARV treatment were only 490 in February 2010. There are now more than 3,000.
You still say it, you've always said it, prevention is better than cure. Is South Africa more curative or more preventative these days?
I think, frankly speaking, South Africa needs that more than any other. The curative form of health care is suitable for very highly developed countries. And so we can't rush over to a curative care. We need to prevent diseases. The mainstay of fighting HIV/AIDS is to prevent it. There's no amount of treatment that can help us. It's to prevent it. And they were saying part of the problem in sub-Saharan Africa some years back was that for every one person that goes on treatment, 2 get infected.
That's right. You're talking about trying to pull people out of the river when 2 more are jumping in.
Exactly. So for any disease, prevention must be better than cure. There's no point in allowing people to have damaged kidneys and try to put them on dialysis and try to replace their kidneys. That's curative care. It's very expensive, but it also doesn't make sense if you can stop it from happening. That is why we are concentrating on these 4 risk factors. What are the risk factors? Smoking, alcohol, poor diet, lack of exercise.
Minister, what about obesity? 60% of our country is either overweight or obese. What do we do about that?
The Medical Research Council has pointed to us that close to a quarter of all the school-going kids in South Africa are now classified as either obese or overweight. Something that me and you never experienced when we were at school.
At school, we were too busy just running around.
Let me tell you, I got very scared in July when you were in Washington. We were sitting with our ambassador to Washington, Mr. Rasool. He was telling Deputy President Motlanthe, he said, you know, he got shocked when he visited supermarkets in America and find wheelchairs and discovered that those wheelchairs are not for disabled people. They are for obese people when they come shopping, because they can't move around the shop. They are too fat to move around. And now that phenomenon is establishing itself around the world, even here in South Africa. One of the biggest contributors to that is the issue of trans fatty acids, which industry loves, but our blood vessels and our hearts and our bodies hate, they don't love. It's causing obesity, it's causing diabetes mellitus, it's causing heart diseases, etc., etc. So what I've done in August last year, I've signed off a protocol to reduce the amount of trans fatty acids in food. But unfortunately, I must confess, you need a clear mechanism to monitor. It's not going to be an easy thing at all, especially in the developing part of the world, because living healthy can be very expensive. And all this junk food that are produced have been made to be very cheap.
Minister, if you were to tweet your advice to all South Africans, what would that tweet be?
My one sentence is that they must avoid the risk factors that causes non-communicable diseases, that causes HIV and AIDS. That means take care of yourself. It's very important.
Ensure a healthy start to your new year with Momentum Health.